Hi there everyone and welcome to today's lesson. Today's VR lesson is on the pancreas. So as you can see, we're looking at our anatomy of our pancreas and we can see our Wirsung's duct, which we'll be looking at in the lesson plan, the pancreatic head, pancreatic neck, body and the pancreatic tail. Okay, so our preparation for today's scanning would include patient fasting for 6 to 8 hours, no smoking, abstaining from chewing gum, and also they may wish to take on a bit of a hydro load, so maybe a cup of water to fill the stomach so that no gas actually can be seen over the pancreatic tail. So let's start scanning and have a look at our pancreas as we can see here. So patient, I'll just request that you push your tummy out slightly. That's it, and we're doing that just to remove the bowel gas from over the top of the pancreas. So what we're seeing here is just relax, patient. There we go. Yeah, we've moved the gas away. Just push your tummy out slightly. As you can see, it moves the gas around. And what we're seeing in our anatomy here is our pancreatic head, which is nestled in our C-shaped loop of our duodenum. Hence, we're getting a slight bit of bowel gas there covering over the pancreatic head. We've got our pancreatic neck, which sits over our SMV, or our superior mesenteric vein. And we've got our pancreatic body, and we've got our pancreatic tail, as you can see nestled here nicely. Now I'm just going to zoom up that image so that you can see that pancreatic tail. Now the black hypoechoic structure that we can see here is our splenic vein. Now that's our splenic vein that courses posteriorly to our pancreatic tail, body and head. Now what we're seeing is the splenic vein coming up over the top, and it's actually running into our superior mesenteric vein, forming our portal confluence. I'll just get you to push your tummy out a little bit there, patient. That's it. So we've got our splenic vein here sitting posterior to the pancreas, running into our superior mesenteric vein, forming our portal confluence. Now behind this portal confluence is actually our uncinate process. So our uncinate process is our fifth portion of our pancreas, and that is tucked away underneath our portal confluence region. Now what we're seeing here is our SMA, which is our superior mesenteric artery. Now it's actually surrounded by this fibrofatty ring. So this fibrofatty ring surrounds the SMA, which is our superior mesenteric artery. Now if we turn in longitudinal in a 90-degree plane, we will see that that superior mesenteric artery comes off our aorta. So this is our aorta, which is our round structure in our transverse view. But here we can see it's our superior mesenteric artery coming off our aorta. So if we turn back in into our transverse view, here we have our aorta. So it looks like a rounded hypoechoic structure. We have our vertebral process here, which looks like a semi-lunar shadow. And here we're seeing our oval or ovoid structure here, which is our IVC. Now going on to the pancreas, we can see our pancreatic duct, which is known as Wirsung's duct. So here we're seeing these two echogenic linear structures. So this is our pancreatic duct, also known as Wirsung's duct. So the measurements for Wirsung's duct is it's allowed to be up to 2 millimeters in the body and 3 millimeters in the head. So we can just see these two white structures traversing through the pancreatic body here. Now moving along to the vessels, what we're seeing here, as we can see, the pancreatic head looks like a nematode or a worm, and what we're seeing at the superior anterior aspect is our gastroduodenal artery. So we can see our GDA sitting nestled nicely in the pancreatic head here, and we're seeing the common bile duct sitting underneath it. So what we can do here is actually put on a bit of colour flow, and it will light up in a nice Doppler fashion our splenic vein. So we've got our splenic vein coming in, traversing over here, coming into our portal confluence where our superior mesenteric vein is. We've got our aorta. I'm just going to turn that gain down slightly. We've got our aorta centralised in the middle here, and we've also got our IVC, as we can see over in this region. Now problems with the pancreas actually include acute pancreatitis, chronic pancreatitis, and these are mainly instilled due to other disease processes, particularly alcoholism. So if we're seeing on our worksheets ETOH, so this means ethanol, and this is a grievance for particularly acute pancreatitis. So when looking at the pancreas, things that we as sonographers should actually look for include pathologies such as acute pancreatitis. Now this may actually incur the pancreas to look quite echogenic, quite fluffy. What we need to do is actually activate our colour. We need to measure the pancreatic head, pancreatic body and the pancreatic tail. So if we were measuring our pancreatic head in a case of acute pancreatitis, what we would measure, first of all, we would get a measurement at the SMA as we've done here, and we'd measure the pancreatic head. Now this measurement here should be under 3 centimetres. The next measurement would be at the body. Now this needs to be under 2.5 centimetres, and the pancreatic tail, which should be also under 2 centimetres. So also what we're looking for is maybe an acute bout on chronic of pancreatitis, or we can get chronic pancreatitis after repeated bouts of pancreatitis. Other things that we may actually see include pseudocysts. So this is where the enzymes have started to degrade down the pancreas and lysis has actually happened. And what we'll see mainly here in the pancreatic head is a big hypoechoic fluid-filled structure. So this is a pseudocyst and quite commonly found on the pancreas. Also, tumours that we need to be aware of include islet cell tumours and also adenocarcinomas. So adenocarcinomas, as you can see, may be masked by the stomach, causing this artefact or shadowing here over the tail. So it's imperative that sonographers get into that tail. Patient, would you mind pushing your belly out and removing that gas by distending the abdominal cavity and showing that pancreatic tail nicely. Now, as we can see here, the pancreas is not surrounded by a capsule. It's a retroperitoneal structure and it's a comma-shaped structure. Now, when we're scanning, we're actually in the plane of the scanning probe. Now, with some other organs, it's in reference to the organ. With the pancreas, it's actually in the plane of the scanning probe. We actually place our probe in the transverse plane in an 8 to 2 o'clock transfiguration, if you can have a look at my probe. So 8 o'clock to 2 o'clock. And the pancreas actually sits on an angle at an 8 o'clock to 2 o'clock configuration. So just think about that when you're performing probe placement. Now, to have a look in a longitudinal plane of the pancreas, we just move the probe through 90 degrees and all we should see is an ovoid structure. So I'm just going to optimise. Patient, could you push your tummy out there for me? That's it, and just relax. So we've got a bit of bowel gas here from the duodenum, and we're seeing our pancreatic head here nicely. So we can see our pancreatic head and neck. We know we're at the neck because we're over the IVC there, and going all the way out, and we're scanning through in our longitudinal plane, all the way through the pancreas, as you can see here, coming in. Pancreas there, it's an ovoid structure, pancreatic head, and back to the middle. Thank you.